Today we're going to talk about the ear, and not just the floppy bit that hangs onto your head that people are always poking holes in, but also the inner parts, the parts that get a lot of the work done. Hearing is the most well-known function of the ear, and that's where we start. Your outer ears are made up mostly of cartilage and skin, forming the pinna and tragus. The pinna is the whorled structure that catches and directs sound into your external auditory canal. That's the little tunnel that leads into the rest of your ear that you're not supposed to stick Q-tips in, but everyone does anyway. This setup helps protect all of the delicate bits from getting in harm's way, except of course for that Q-tip that you're mercilessly shoving in there. Once a sound wave has made it to the end of this canal, it runs smack into the eardrum, your tympanic membrane. This thin sheet of tissue is stretched across the end of the canal and is made of two main parts. The larger part is the pars tensa, the tense part that does a lot of the vibrating, and the smaller part is the pars flaccida, a loose part that sits in the corner and doesn't really contribute much to hearing. The elasticity of the tympanic membrane is about the same as a sheet of rubber. The effective area of the tympanic membrane is between 50 and 60 square millimeters, about a quarter of the size of the dime. This structure forms the border between the outer ear and the middle ear. The middle ear is normally an air-filled chamber that serves as a transition point from the outside world to the inside world of your central nervous system. Attached to the middle of the tympanic membrane is the first of the ossicles, the smallest bones in the human body. The malleus, the incus, and the stapes, or the hammer, anvil, and stirrup, form a tiny chain leading from the eardrum through the middle ear to the inner ear. They're held in place by tiny little ligaments and even have some muscular attachments as well. The manubrium of the malleus, aka the handle of the hammer, is flat up against the eardrum, and when the eardrum vibrates, those vibrations are passed right into the malleus, through to the incus, then into the stapes. The stapes is the tiniest bone. It's at the end of the ossicular chain, and it's shaped just like a tiny little stirrup. Its 2 feet sit on a bony plate called the footplate. The footplate is a tiny little bone covering at the entrance to the inner ear. That entrance is called the oval window. When sound waves reach the footplate, it vibrates back and forth within the oval window and acts like a tiny piston vibrating the fluid on the other side of the window. The purpose of the ossicles is both to transmit and it acts as an impedance matcher. What that does is minimize the reflection of the vibrations from the air into the inner ear fluid. To amplify the sound, it does this in 2 ways. First, it acts as a lever system. When the handle of the malleus moves, because of the shape of the malleus and incus, the incus moves in a slightly larger dimension. Also, it acts to amplify sound by overall decreasing the size of the moving structures. Remember, the effective eardrum size was about 55 square millimeters? Well, the oval window is only about 2.5 square millimeters, so there's a huge mechanical advantage in transmitting sound by that size decrease. It's like getting stepped on by a snowshoe or getting stepped on by a stiletto heel. Sometimes you'd actually like to hear less, like when there's a dangerously loud noise, or just when you're talking. During these times, small muscles called the tensor tympani and the stapedius, attached to the malleus and stapes, contract to dampen their motion. One reason why recorded voices of yourself always sound funny to you, but to no one else. You are hearing the undampened version that other people always hear. The inner ear is the most complex part of the ear and contains arguably the most vital structure for the sense of hearing, the cochlea. Outside of the brain, of course. The cochlea is a set of 3 fluid-filled tubes, 2 filled with a fluid called perilymph, and a single one in between them filled with endolymph. These 3 tubes are coiled around each other within a bony canal that looks a lot like a snail shell. Sound waves coming in through the oval window are passed first into the first tube, travel around about 2.5 turns to the tip of the cochlea, then turn right around and go back the opposite direction through the coil through the other perilymph tube. The vibrations have to go somewhere, and they're let out again into the middle ear cavity at another window out of the inner ear, the round window. That third tube in the middle of the cochlea contains an organ called the organ of Corti. It's a configuration of specialized cells called hair cells that, like their name implies, have hairs called cilia that are jiggled back and forth when sound waves pass by. The jiggling of the cilia causes these cells to depolarize and send a neurologic signal out to the brain through the cochlear nerve. That signal is what you interpret as sound. The cilia of the hair cells are attached to a membrane which varies in stiffness from the base of the cochlea, where it is quite stiff, to the apex, where it's loose and floppy. That translates to hair cells only firing at the base if sound waves are energetic high frequency, whereas low sounds are only detected up at the apex. There are 15 to 20,000 hair cells, each firing to a specific frequency depending on where along that gradient it lies. The inner ear contains another small set of structures that doesn't get as much press as the cochlea, but contribute to the sense of equilibrioception, a sense that's left out of the traditional five senses, probably because it's too hard to say. Right next to the base of the cochlea is a peanut-shaped cavity called the vestibule. This contains two sacs of fluid called the utricle and the saccule. These sacs have patches of hair cells that detect linear forces, like gravity, and allow you to tell which way your head is positioned. The cilia of these hair cells are embedded in a gelatinous substance studded with little calcium carbonate crystals called otoliths, or ear rocks. This dense substance makes these cells sensitive, but occasionally an otolith can break free and wreak havoc when it gets into the semicircular canals. The semicircular canals are 3 rings of fluid attached to the vestibule, each lined by cells that can also detect movement, but because of the ring structures, this makes them sensitive to rotational acceleration. Nerve signals from these structures can bypass your brain altogether and go straight to your eyes, letting you keep your eyes in one place when you turn your head without thinking. Try it. Or, even more difficult, try stopping it. If an otolith is bouncing around in these canals, setting off these little hair cells, it can cause horrible vertigo by tricking your eyes and brain into thinking your head is spinning, even when it's not. So there you have it, a rundown of how the ear works from the outside in.